All right, well, hello everyone. Thank you for joining us today. I wanted to welcome you to the Dental Compare live webinar series. My name is Dr. Jeff Rohde. Today we're going to be looking at another amazing use of diode lasers in your practice. You know, these have been around in dentistry for a while and they do so many amazing things. And you're going to learn a simple approach to integrating laser whitening into your practice. It's totally doable, and Dr. Christina Doe is going to show us how. So the program itself is going to go about 45 minutes, and then we'll have a chance for a question and answer time. After that, just in case you have any questions, remember you can type them right into the window right there and we'll see them live. Now that also includes technical issues. If you're having trouble hearing anything or whatever, I mean, definitely let us know. We want to make sure we're making this as easy as we can for you. Keep in mind also, if you'd like to watch this again, there will be an archived version of it. So if you want to tell a colleague about it, or from the tips that Dr. Doe has for us, if you want to sit down with your staff and show them and kind of do it step by step, this will be available on Dental Compare in about 24 hours from now. I also want to remind you, if you look at the bottom of your browser, there is a little Documents tab. In there, there's some brochures for the laser that she's going to be talking about from BioLase, their new Epic laser. So you might want to check that out. There's a couple that's being highlighted right now. A couple brochures there, just PDFs that you can download and take a look for yourself. So now our webinar speaker today, as we said, is Dr. Christina Doe. She's a graduate of Loma Linda University School of Dentistry and is in private practice in Costa Mesa, California. Beautiful Costa Mesa. She is trained in laser dentistry with some of the leading laser professionals in the world, and she's currently lecturing and doing research for BioLase. She also is on the executive board of the Coleman Research Group, which connects medical investors with experts in the field of dentistry. She also serves as the senior delegate for the Orange County Dental Society and secretary to the Orange County Children's Dental Health Foundation. Now, about kids, she's also the author of the award-winning Tooth Tales, an animated children's educational DVD. You may have even seen her on TV, you read her work in multiple dental publications. She's just an excellent resource for us, and we're glad to have her today. And as we said, today we're going to be talking about diode laser teeth whitening. So please help me welcome Dr. Christina Doe.
Thank you, Dr. Rohde, and hello to everybody, and thank you so much for logging in to learn about laser whitening. This is definitely something I'm super excited about because my patients are constantly wanting whiter and brighter teeth. And so constantly I've been trying different types of whitening procedures to see how I can benefit these whitening procedures for my patients. So I'm here today to share about laser whitening with a machine by the BioLase company called the Epic laser. So basically what I notice for my patients is our patients feel good when they look good, and basically when we look at them, they want to look better through their wardrobe. So going back, let's talk about the power of a smile. Everybody knows what a smile means, and everybody knows how important a smile actually is. And everybody knows that if we don't brush our teeth or take care of our teeth, our smile will not be attractive. So before the power of speech, there was always the universal language of a smile. So as dentists, we have that power to give any person a beautiful smile. So if our teeth and our smiles are not as bright as they are the way we want it, then basically our patients will come and ask us, how they can go about getting that. And it's in our power to communicate all the different options for our patients on how to get that whiter, brighter teeth. You know, the power of a smile is very important for the confidence and for the psychological benefit of our patients. The power of a smile gives our patients a better rapport with people they come into contact with. It can break down walls of influence. It can affect the choices that people make in their lives, and it can change lives. A smile, as you know, can give people hope and share a really positive attitude in life. And a lot of times when you see a smile, it shares the language of love, understanding, humility, and kindness. So basically, that's what we are experiencing today. But a smile can go all the way back, and once I did some research, it went into basically 4,000 years ago. And what I learned was the ancient Egyptians also wanted to have beautiful smiles too. And the way that they did this was they took some pumice and white vinegar, and they would just dip a stick into it, this mixture, and then chew on the stick. So we're lucky that today we have, you know, less archaic way of whitening people's teeth. And then the Romans had another way of whitening their teeth. And what they did was they used human urine to whiten teeth because the ammonia that was found was supposedly really helpful. So as we said, there's always a better way of doing that whitening procedure. So my slides are going crazy. Okay. So anyways, and if you also did some research in the past, you knew that barbers also whitened your teeth. And a lot of people go around and look for the old red and white barber pole and use the barbers to whiten the teeth. And back in those days, barbers also did a lot of dentistry too. So as you can tell, that a sparkling smile for people in the 1800s, the barbers would file down patients' teeth and use a corrosive nitric acid. And patients would end up getting a very pretty white smile, but at the cost of destroying the enamel. So here's a poll question for us today. We're wondering approximately how much is spent annually on whitening for Americans. Option 1 would be, do we think people spend $250 million? Option 2, do we think people spend $500 million? Option 3, $1.5 billion, or option 4, $2.5 billion. If you think about it, of all the patients that you have who are constantly asking for whiter, brighter teeth, this number, we would say, would possibly be very high. And it looks like most people have said about 1.5 billion. So let's see what we think it is. So whitening remains one of the single most economical ways to enhance your smile. As you know, if you did a full set of veneers or if you did a lot of crowns on your teeth, that would probably cost your patients a lot. So Americans spend about $1.4 billion annually on tooth whitening products. And this includes tooth whitening toothpaste. It includes the crest strips that you take at home. It includes all the different types of whitening materials that the dental offices provide as well. So $1.5 billion annually is a really large sum of money, as we can see. And it totally goes to show that there are so many types, so many people in this world who definitely want to have brighter, whiter teeth. And over in the past 5 years, we know that whitening has become more and more popular by the increase of 300% just in the last 5 years. So teeth whitening makes your smile sparkle. About 99.7% people believe that a smile is a very important social asset. And if you look at all the different research, it's shown that people who have a nicer smile and who have a nicer appearance a lot of times will get the job that they interviewed over someone who does not have the nicer smile or the nicer appearance. 96% of adults believe an attractive smile makes a person more appealing to members of the opposite sex. So what I spoke about before is a smile actually gives someone an introduction of invitation that could include a smile of kindness or a smile of understanding or love. 3/4, 75% of adults feel an unattractive smile can hurt a person's chances for a career success. And if you read all the articles that are out today, it definitely shows that if a person does not present themselves well, whether it be in their appearance of clothes or hair or their hygiene appearance, that can definitely hurt them. And if we pull for all of our patients and just people who we meet on the street, what they would like their smile to improve by, your most common answer is always brighter, whiter teeth. So there's many different, the process of different whitening methods. When we whiten our teeth, we can use a peroxide-based chemistry through an oxidation process. The organic material in our teeth reflects a specific wavelength. So we have to make sure when we're choosing some of our patients to whiten their teeth that we know that every patient will have a different type of result. You can use a peroxide that oxidizes the color-producing compounds. And eventually what will happen is you'll eliminate and reduce a lot of discoloration of your patient's discolored teeth, and then eventually leading to whiter teeth. So there are many factors that influence the whitening process. Basically, when we're choosing our patients to do laser whitening or any form of whitening, we have to make sure that our patients are good candidates for the whitening process. So in order to do this, we have to make sure that our start color makes sense when we choose to whiten our patients. If you have a patient who is a B1 or a 1M1, your patient probably will not get the result that they end up desiring. So you always have to make sure that your starting color is of utmost importance when you decide to go forth with offering some form of whitening procedure for your patient. There's always a unique and inherent whitening potential. Not everybody's teeth will whiten to a certain color. Everyone has different enamel composition. Everyone's teeth at some point will hit a plateau and unfortunately not whiten anymore. So it's very important that you put down and communicate your expectations for your patients. A lot of times you have to make sure that your patients have clean teeth. We usually whiten our patients' teeth, laser whiten them after their hygiene visit. So, or if we have patients who might want to do some touch-ups after they do a whitening, if they want to do a whitening procedure, then just make sure that their teeth are clean prior to that. And the percentage of the whitening agent is always very important. You can send your patients home with a 15% whitening, or you can send them home with a 30%. So there's very many variables in terms of having your patients whiten their teeth. And then also the duration of time. Some patients, if they want to whiten at home once a day versus twice a day, will get whiter brighter more quickly if they decide to whiten twice a day. Some other factors that influence the whitening process is you have to make sure your patients are compliant. If you decide to have your patients whiten on a daily basis at home, you have to make sure that they actually follow through and do it on a daily basis versus every other day. A lot of times when your patients whiten every other day, it causes the dental tubules to open and then close and then open and close, and you're not going to get the result that you had anticipated in the desired time. Oral habits, basically that's just home care. You have to make sure your patients are compliant in the sense that they're brushing and flossing on a daily basis. There are certain foods that sometimes you have to ask your patients to forgo for about 24 hours. A lot of times those are the foods that actually end up staining the teeth, and that would be basically, as you know, the wines and then the darker fluids and the darker foods. A lot of patients, as you know, have the nicotine stains, and so if your patients are wanting to whiten their teeth, then they definitely should have or abstain from smoking. to not have those stains come about, and also chewing tobacco as well. There's just a couple side effects when you have your patients whiten their teeth. We have found that you can get soft tissue irritation. Sometimes when you have the gel go onto the tissue, then the tissue may become white. Definitely let your patients know, even though their gum tissue has turned white, it definitely, once it gets rehydrated, then the tissue will return back to its normal color. You can also expedite that dehydration for your patients by just grabbing a vitamin E capsule and putting the gel onto the gum tissue. And the other thing that is a side effect for whitening is hypersensitivity. And as we know, hypersensitivity is our biggest culprit for patients not wanting to whiten their teeth and having problems whitening their teeth. So luckily today we're able to learn about laser whitening, where we are now able to eliminate that hypersensitivity. It's actually pretty easy to eliminate the soft tissue irritation with the laser whitening system as well, because you'll be putting on a liquid dam and protecting that soft tissue. And so it's really nice that we're able to have this option of laser whitening to eliminate these side effects that are associated with whitening with the other systems that are out there. So the different methods of whitening, as we know, that we're able to offer to our patients are the whitening strips that, I guess as dentists, we don't always let our patients use that, but sometimes when I have younger teenage patients who might not be that dark, sometimes I offer whitening strips for them to go and purchase. The take-home trays, obviously, we do those a lot on a daily basis of offering, just because the patients are able to take them home and whiten at leisure. There's also in-office whitening, and one example of that would probably be, as we all know, the Zoom, or just some form of power whitening. I was actually doing power whitening in my practice prior to learning and incorporating the laser whitening system, and I was getting a lot of sensitivity with the in-office whitening, which was the power whitening, and then I had Zoom done on myself and had a lot of sensitivity. So because of that, I wanted to look into how I could find another way to give my patients a great experience of having brighter, whiter teeth faster and without the sensitivity. And that's how our last method of whitening was the laser whitening method. So here's a question for everybody. How long does it take you as a dentist to do a whitening procedure that is a non-laser whitening procedure? So basically, you can think about what you would do for your patients if you give them trays to take home, how long that would be, or you can think about a non-laser whitening procedure at Zoom, or a power type of bleaching that you do in your practice. So when I did the non-laser whitening in my practice, it was about, could vary between 60 to 90 minutes. As we know, prep time is always about, can take up to 10 minutes or so. And then after that, the gel has to sit on the patient's teeth for quite some time if you're doing an in-office whitening procedure. So option 1 was 20 minutes, option 2 was 30, option 3 was 40 minutes, and option 4 was 50 plus minutes, which pretty much seems that everyone is on the same page. That came out to 69%. And I can definitely agree, because that's how long it took me as well. So here it is, the typical duration for different in-office bleaching techniques. Your in-office whitening was 60 minutes chair time. Your Zoom, which is also in the office, was about 60 minutes. The laser smile, which was the precursor to the Epic, was about 40 minutes. And the Epic 10 is now 20 minutes. And so this 20 minutes is chair time from start to finish. So basically what it breaks down to is you will only have the bleach on your patient's teeth for about 8 minutes total time. As we know, whenever we're doing any type of dental procedure, we want to make sure that the ADA supports it. And the ADA did a research project and put the Bright Smile on to research the Laser Smile, the Easy Lace, the Zoom, and tried to find the different average change in the color values just based on the incisors. I know this chart's hard to read, but basically that's what it's telling us. And then the ADA product review wanted to know how effective the Diode laser whitening system was compared to the other professional ones. So what they did was they did a value change in the value of E to see what system had brighter, whiter teeth, and without the pH causing a decrease in the enamel hardness. And through all the different research that they did, the results showed that after 24 hours of doing this, the Diode laser whitening system showed the most whitening of all the incisor teeth as compared to the other type of whitening systems. It definitely had a better change in whitening, but at the same time, what it did the best of was it did not have the sensitivity that all the other systems had. The measurements were provided by a color measuring device, so that device gave us a much more accurate measurement than if we had just done it visually with color shade tabs. So as we know, we do our own research, I guess, in a sense, in the dental practice, trying the different types of whitening procedures that exist to see which one works the best for our practice and which one is the most successful for our patients. And for myself, I did that, and I found it for the laser whitening system. But it's nice to know that we are also backed up by the ADA with all the clinical studies that are out there, knowing that the BioLace laser whitening system is definitely very successful in terms of getting the results we want, and at the same time keeping our patients less sensitive to the whitening system. The AACD also did an article for the Laser Smile Tooth Whitening System, which is the laser whitening system. And as you know, the AACD is the American Academy of Cosmetic Dentistry, so that's definitely a great back supporter for being able to do laser whitening with this system, knowing that they also support this success for us. And also, the laser system, the BioLace laser system, provides a shorter exposure for the treatment time. So that's an added advantage in terms of also getting backing by the ADA. The participants who were getting the laser whitening system were very satisfied with their end results. And we, by using the laser whitening system, we got a better whitening efficacy than the arc lamps, meaning the Zoom system. And then also, basically, with the Laser Smile, we were able to get an 18% better average shade improvement than all the other whitening systems. So in the end, through all the data provided by the ADA, we were able to get that the Diode laser was an effective tooth whitening system and also at the same time very, very successful. So this is just a little statistics about just the practitioner input. It's a web-based survey with the ADA, and these were from 375 responses from dentists about their experience. So basically, 71% of dentists use whitening products. It's a very large component of our dental practice here in Costa Mesa. Virtually pretty much everybody wants whiter teeth, and so we had to find a way to deliver success for our patients, but at the same time also have options for our patients. We even had patients between the ages of 12 to 18 who wanted whiter teeth as well. The ADA showed it was about 26%. So, you will always have a huge gamut of patients who do want whiter teeth from the ages of 12 all the way up to pretty much 90. I had a patient who was about 80 years old who wanted her teeth brighter, and basically we did end up doing laser whitening for her. So, at any age, at any stage in your life, you definitely want to have some form of whitening options for your patients. So 66% of dentists stated that their patients did not, only half of their patients had sensitivity. 50% of dentists have to sometimes treat their patients for sensitivity. So my main goal for doing laser whitening obviously is to always have our expectations met for our patients in terms of whiter, brighter teeth, but at the same time I do not want my patients to have sensitive teeth. And so through that, we have to try different methods to make sure our patients are well taken care of and their anxiety level or their expectations are exactly what they were anticipating. This is a clip of an at-home whitening gone wrong.
Oh my God.
What happened to your teeth?
I whitened them. Really? Yeah, what do you think?
Well, I think I shouldn't look directly at them.
Come on, seriously.
They're really, really, really white.
Yeah, what was wrong with your old human teeth?
I did leave the gel on a little longer than it said to.
How much longer?
A day.
Plus, you know that tonight is your date with Hillary.
I know, that's why I did it. Come on, are they really that bad?
No, you'll be fine. Hillary's blind, right?
She will be after tonight.
Yeah.
Okay, so I put that clip in just to basically show that, there is a particular special way that we are supposed to do our whitening procedures. If you send a patient home and the patient doesn't follow through on the directions, you can have the results that you might not want. And so, and it's the same way with the laser whitening system. There is a very easy protocol to follow, and if you follow it, basically you'll end up getting the results that you want. And so the laser whitening with the Epic is definitely successful, and it definitely has met a lot of my patients' expectations. And so through that, we want to make sure that we
I've had a really good time tonight.
follow the protocol in order to get there. So some specs about the laser whitening with the Epic is it's a very fast way for us to whiten our patient's teeth. It's a 20-minute procedure and of gel-to-tooth contact. So basically, in the past, you had your patient sit in the chair for about 60 minutes from start to finish in order to get the same result that we are going to get for our patients in the chair for 20 minutes from start to finish. The laser whitening system has a handpiece that's contoured for the entire quadrant of the teeth at once. So basically, you are whitening in quadrants at a time. And the BioLace system uses a whitening technology in order to, the gel is accelerated by the laser system. So whenever you're using your laser whitening system, you have to make sure you're using the specific whitening gel that's made by BioLace in order to get the successful results of whitening your patient's teeth. This is the Epic whitening handpiece. It's very easy for yourself to hold when you are whitening your patient's teeth. It's very lightweight, so you will not get any fatigue, and it's very ergonomical, so that way it fits comfortably into your hand, but also at the same time, the head of it fits over your patient's mouth very easily. And so you're able to get in there and whiten the areas that you need to for your patients. If you remember when you had the Zoom, it was a big entire light that went over your patient's teeth, and so that was not very comfortable for your patients. A lot of times what it felt like were that they were very claustrophobic. When I did power whitening, I had to use a light-activated curing handpiece, and so that one just had a little round diameter, so we would have to whiten one tooth at a time virtually. So because this is a long-spanned handpiece, we're able to whiten in quadrants and be very efficient about our whitening procedure. There aren't very many supplies when you want to do laser whitening for your patients. You need an Epic 10, which is the whitening diode. But the Epic also will do soft tissue procedures and pain therapy as well as laser whitening. You'll need a whitening handpiece, protective eyewear that's specific for the laser itself, and then you'll need a laser white 20 kit, which is the gel kit that comes with the rubber dam kit, or the rubber dam material and the gel. So virtually, with just 4 items, you're able to do laser whitening for your patients within 20 minutes. So there's many criteria if we want to be successful when we whiten our patient's teeth. When I have a patient come in who wants to whiten their teeth, basically we have to start from the very beginning. Just because a patient says, I want whiter, brighter teeth, does not mean that you automatically just, in a sense, offer to them your whitening procedure, your laser whitening procedure. You have to make sure that you set your patient up for the best form of success that you possibly can. So through that, when I have a patient who comes in and says, I really want whiter, brighter teeth, then we start the process of getting to know what the patient's expectations are and also communicating how we can go about getting this for our patient. So you have to make sure your patient's in good general health. You know, if you have a patient who's pregnant or a patient who has horrible periodontal disease, you know, obviously this patient is not a good candidate for whitening. So unfortunately, as much as we all want our patients to be happy and to get what they want, sometimes you just can't get there if they don't meet the criteria for the success. So good general health obviously is very important. The healthy periodontal condition is very important. You know, a lot of our patients have horrific periodontal disease, but then they only focus on wanting whiter teeth. So obviously we have to change our focus a little bit and help them get healthier gums and teeth before we can go about offering the laser whitening. I usually like my patients to be at least a baseline of A2 or darker. And the reason being is I found when I was doing research with the in-office whitening and the laser whitening, any patients who were brighter than an A2 didn't always get the wow factor that they had after the whitening. So with patients who are not as dark, what I usually end up suggesting is to do custom trays at home. And I also found that if we have our patients avoid dark staining foods for about 24 hours, their whiter teeth stay whiter for a longer period of time. Let's see. Some other ones is basically when you have your patients screened, whether they're good candidates or not, you have to make sure that they do not have composite resins in the anterior region. Some patients, as you know, have a lot of fillings inside their mouth or a lot of crowns peppered in their anterior region. So, you know, it's very important that you communicate with your patients how important it is to not have certain areas that may not bleach. And so it's really important that we communicate that with our patients in order to get that successful result. I noticed that patients who have deeper intrinsic stains, you know, similar to tetracycline stains, unfortunately, I found that with my whitening system, it does not get that whiter color. You can definitely get a brighter color, but you definitely won't get white. So your patients will still have the same color, their teeth will just look a little bit brighter. So you have to make sure if you decide to use that patient for that procedure that you communicate that. I found that yellow tones when you're doing laser whitening shows for a better form of success than if you use a grayer toned patient. And you always discuss the predictability and the efficacy with the patient prior to the start of whitening process. So that's the point that I always want to drive home. You always want to know what your patient's expectations are and how you as their dentist can establish that expectation for them. You want to make sure it's realistic, and you want to just make sure that they leave your office with a good result that they were expecting. So in order to prepare our patients, once we know that they are a good candidate, then we want to make sure we do a thorough intraoral exam, making sure that there's no areas of decay, obviously, and you want to make sure that their dental health is nice and healthy. We always try to have current x-rays, and the reason why we're able to get this is when we do our whitening, we usually do it after their prophy visit. You definitely want to assess your patient's sensitivity level, and just so you know where they're at. We're lucky that now we have our laser whitening system, and we're able to not have that sensitivity be a factor. But if you weren't going to use it, then you have to make sure you assess that sensitivity. You have to make sure you have photographs before you start your procedure so you can document and show your patients what they started with and what they ended up with. You want to use the Vita Shade Guide, and in the past we were using the classical Vita Shade Guide. Now there's the other one that we use, which is the 1M1 system. So this is the Vita Classical Shade Guide of 16 shades, and from B1 to C4. I don't know if you guys have this problem, but our office definitely does. We put them A1, 2, 3, 4, and it gets all messed up. But you have to know that it goes from B1 to C4, from lightest to darkest. The Vita 3D Master Shade Guide is actually what a lot of offices use now and a lot of labs use. And so we've switched to this, but you can actually use the Master Shade Guide, the 3D one, and pair it with the Classical Shade Guide. So just make sure that you have a start color and an end color for your patients. Some tips on improving shade matching is basically once we look at the patient's teeth, we know their shade. You have to make sure your light source, you don't want to be shining a bright light on the patient's teeth because a lot of times that'll give you an incorrect reading. You just make sure your environment where you're measuring the shade for your patient's teeth is proper. And a lot of times some clinicians might be a little bit colorblind, or they're not able to choose color as well as others. You have to make sure you have the proper clinician picking the color. And whenever you're matching up the shade tab, you want to make sure that you're just putting one up at a time. If for some reason you have so many different colors that you keep looking at, you want to make sure that you look at a neutral surface in order to prevent eye fatigue. So we want to make sure the lighting in the dental operatory is correct. Some people will use a color-corrected light source that has a color temperature of 5,500 Kelvin, and the light intensity is ranging from 200 to 300 foot candles. So there is a perfect environment that you can create for your office if you choose to when you're choosing shade for your patients. A lot of times in the office you want to have a neutral light gray background color and non-glare surface countertops. And the floor should be neutral in color in order for you to pick the colors properly, the shade properly for your patients. So let's talk about how to whiten our patient's teeth with the Laser Whitening Epic, the 20-minute one. And we talked about how it only takes 20 minutes, and basically all you need is the laser itself, protective eyewear, and the whitening handpiece. And on top of that, every patient gets an individual kit. And so basically these kits are about $50 when you purchase them. And when we do laser whitening in our practice, we charge our patients about $1,000. So it's a really good profit for us, and at the same time giving our patients exactly what they were anticipating. So the kit contains the whitening syringe, whitening base gel and the gel activating system, and then it contains a syringe of the liquid dam and all the tips that you'll need to whiten your patient's teeth. You have to make sure the gel is always in the refrigerator, and you can take it out probably 30 minutes before you start your whitening process, but just make sure the minute you get the whitening kit that it is refrigerated. So the procedure of doing the laser whitening is you want to make sure you clean your patient's teeth with pumice that does not contain glycerin. You make sure that the dental plaque and calculus is removed from your patient's teeth. All the superficial stains are removed, and you apply Vaseline to the lips, and you insert the cheek retractors. We also use cotton rolls to make sure the saliva is constantly not getting into the area we're working on. So you have to make sure your environment is definitely nice and dry. So first, after you have your patient in the chair, you put on the liquid dam application after you've rinsed and dried the teeth. You express the liquid dam onto a mixing pad to make sure the flow is proper. If it's too runny, what we found in the past is sometimes it means that your room temperature of the room might be too warm. You want to make sure when you put the liquid dam on, it's 0.5 millimeter extended past the tooth structure. You want to make sure you cover any exposed root surfaces, and you want to protect one extra tooth at each end of arch. And then after you put the liquid dam on, you have to make sure you light cure it. So whenever we choose which teeth to whiten, we have the patient smile in the mirror, and whichever teeth are in the smile line, those are the teeth that we bleach. But we always put the liquid dam one tooth in extension. After the liquid dam application is placed, then you mix the activator and base gel together. When you have the two syringes and you screw them in together, you mix them 25 times. When you mix, you have to make sure that both fingers, both thumbs are on the plunger of the mixer, and then you mix. And so if you don't have both fingers on the end of the plungers, if you push it too far out, then you'll push one plunger out and cause a lot of the gel to escape. So after you mix your gel, you apply your whitening gel to the 4 treatment sites, which are the 4 quadrants. And basically the gel will go on in a very thin consistency. And the gel will eventually be a purple color. If you put too much of gel onto the teeth, it'll be a very dark purple color. So you want a very light pastel purple when you're placing it on the patient's teeth. And it's very important to do it this way, because if you don't, then you will not get the results that you want. So many times one mistake that clinicians do is they put too much gel onto the teeth. And that's when you start to whiten. You whiten your teeth 1 quadrant at a time. This is what your rubber dam isolation should look like. So the EPIC settings, basically when you're using the laser, it's very easy. It's one button. It'll say laser whitening. You push the laser whitening button, and this is the settings that you'll be at, but basically everything is set for you on your laser. So with one button, you start your laser whitening procedure that's at 7 watts, 200 joules in a continuous mode, and it whitens 30 seconds per quadrant. So when you do this, you do 30 seconds per quadrant, 2 passes. That gives you 2 minutes, and then the second pass would make it 4 minutes. You remove the gel that you had just placed, and then with the high-speed section, then you reapply a second layer of whitening gel, and then you do it 2 more passes. So that gives you a total of 8 minutes total of whitening gel on the teeth. And you usually just want 2 gel applications. And if you need a quantitative thickness of how thick your gel would be, it would be about 1 millimeter. So this is the pastel color of purple that you want to have on your patient's teeth when you are whitening your patient's teeth. At the end of your finished procedure, you want to measure with what your new shade color is, and you want to make sure you take after clinical photos. Sometimes if your patients need to that maybe they feel like they might have a little zinger, or if you feel like your patients want some form of desensitizing gel, with the laser whitening system, there's a potassium nitrate. You can have your patients take that home, give them a custom tray to put the desensitizing gel in if they need it. I've never actually used it in our practice before, but it is available if that's what you would like. I am going to skip over this actually and go into our clinical cases. And basically, you know, what we spoke about is we want to make sure we totally exceed the expectations of our patients. And in order to do that, we do it through forms of communication, making sure we reach all of our treatment criteria in order to get to that point. So here are some clinical cases. I'm just going to show you some photos of our before and after. This patient's top teeth were all crowns, and obviously this patient really wanted virtually a 1M1 shade. And this patient, if you look at the before photos, that's what the patient had before, and then we laser whitened the bottom teeth, and then this is what we ended up 20 minutes later from start to finish. So the patient was thrilled completely, because before the patient came in and sat down, the patient had a different shade up top from the bottom. After the laser whitening procedure, we were able to get this patient completely, I think she was a 3M2 before, to a 1M1. So that's likening to an A3 to virtually a B1 shade. These pictures, I put two of the top ones are the after pictures, and the one on the bottom is the before picture. So this patient went from a C3 to a C1, which is 8 shades lighter in 20 minutes. I had this patient, this is my only patient who had a few zingers during the procedure, and after that, every single patient that I've done since then has had no sensitivity at all with laser whitening. So like we spoke before, basically when you're doing this procedure, you want to make sure your lighting conditions are good. So that way you're able to measure the before of C3 and to C1. Some patients have a lot of translucency to their teeth. You have to make sure that you touch upon that before, but obviously this patient did not have that. Another case that we did, this patient went from an A3 to an A1, so that's 7 shades lighter. Let's see, I can share a contraindication with you for when you're doing laser whitening. You want to make sure that your patients do not have allergies to hydrogen peroxide or resin-based materials. So that would be the only limitation for whitening your patient's teeth if they had these things. This patient went from a D3 to a B1, and this was 9 surfaces of shade slider. This patient went from an A4 to an A2, and this patient went 10 shades lighter. Sometimes we've had people ask if they should anesthetize their patient's teeth for a whitening procedure. We definitely do not give any anesthesia when we whiten teeth. This patient went from a D3 to an A1, and this was 8 shades lighter. And basically, another tip that you can also give your patients is if you are going to whiten patients' teeth and then do a crown after, you want to wait at least 2 weeks, because sometimes patients can get a rebound effect of tooth shade. And so, you know, whenever we're doing whitening and then doing a custom shade in a lab or doing a new crown for our patient in our office, they always require about 2 weeks before you can do a color shade match. This patient went from a C3 to an A1, and that's actually 12 shades lighter. This patient, we've actually in the past had some patients who had some areas of hypocalcification, and so just keep in mind if a patient does have that you let them know those areas will bleach faster than others. This patient went from a C4 to a C1, which is 10 shades lighter. And this patient went from an A3 to an A1, which is 7 shades lighter. So these photos that I'm showing you basically is just to really emphasize that we definitely are getting, the results we want. At least, 6 to 7 shades lighter on our patients in just virtually 20 minutes without any sensitivity for our patients. This patient went from a D4 to a D2, so that's 4 shades lighter on that one. And then this patient was an A3 to an A1, which was 7 shades lighter. So we are definitely achieving what we want for our patients. This patient also went from, this patient was actually an A4 going down to an A1. So we've been really successful in, just doing laser whitening procedures for our patients, getting really great results for our patients. This is one of my most favorite cases. This is a 20-minute case, and this patient was extremely ecstatic after the results of his whitening procedure. So 20 minutes later, super white teeth and without any discomfort. So what more can we possibly offer to our patients to provide this great success for them? And so what we did when I first was able to get the laser whitening Epic, and I wanted to find a way of how to let my patients know that this was available for them. So our marketing strategy basically was to do a reduced fee for laser bleaching. We sent out a blast email to our patients stating that we had a new way of whitening patients' teeth without the sensitivity in just 20 minutes. So knowing that we were able to reach patients who wanted quick results without sensitivity, we were able to, with one blast email, we were able to get about 20 consults within 2 days. And so 20 consults for us turned into basically 20 different procedures that became really successful. And we were able to touch our patients' lives, change them by a brighter, whiter smile, and at the same time really, really find a product that gave us the ability to affect our patients with whiter teeth and completely eliminate sensitivity for our patients. So I've been very, very pleased with the Epic laser whitening system in our practice, and just the fact that I've been able to change lives and improve people's smiles, improve people's appearance of themselves, and on top of that, being able to affect their confidence and knowing that they're actually getting exactly the expectations that they have desired. So we definitely have time for questions. I know you guys probably have questions in terms of the laser whitening procedure, but I was just here to share how great the laser whitening has been for my practice and how great it's been for our patients. So I thank you very much for listening, and I really hope that you will incorporate laser whitening into your practice so you can share it with your patients too.
Yeah, Dr. Doe, this is Dr. Rohde again, everyone. Thank you so much for listening. Dr. Doe, that was just awesome. And I mean, you broke it down so clearly about how we can integrate this into our practice. One of the requests that we had was to, I think I found it here, to pop up. This is Dr. Doe's order that she has, the classic shade guide in terms of lightest to darkest. So for those of you who want to kind of jot that down, that's there. Dr. Doe, I had a question for you. One of the things that looks like BioLase has done here is just simplified the procedure, simplified the menu on the laser. It's just everything seems so straightforward. But oftentimes we kind of, we look at this and we go, okay, all that makes sense. And then we get into our practice, and then all of a sudden it's like there's like, oh, well, there's this thing and that thing. It's sometimes the actual best practices are sort of befuddled by common mistakes. So since you've done so much of this, what are some common things maybe you guys have encountered that might be some tips for us when we try this for ourselves?
Okay. Well, I think my very first common mistake was the fact that I put way too much bleaching gel on the patient's teeth. And so my first disgruntle was probably the fact that I put the gel on and then all of a sudden I didn't have enough for the second application. And what I realized was less is better, because the more gel you place on the patient's teeth, the thicker it is, and it's harder for the laser to activate and get the result you want. And so if you have a dark purple shade when you're placing it on the patient's teeth, you won't get the result that you want. And so it won't be as effective, and you won't get the as white as you were anticipating. So a very thin layer of 1 millimeter thickness maximum is what you actually want for your patient's teeth. It's a very, very common mistake. That's probably the biggest blunder of any person who starts with a laser whitening. So you always have to make sure the color is a pastel-y purple. And actually, if you put the gel on and then you activate it with the laser, you can start to see the laser gel bubbling. And if you put it on and it's too thick, you will not see the bubbles, basically. It's just way too much thickness, and the laser doesn't penetrate that gel as well as if you had put it on a thinner layer. So that's one common mistake. Another mistake that I've heard some people do is when they mix the gel together. It's more of an annoyance in a sense. When they mix the activator gel and the base gel together, they don't hold the plunger down with their thumbs, and they push one side through, and then out pops the plunger on the other side. So they end up wasting gel. So you have to make sure when you take the activator gel and the base gel and you screw them together and you start mixing the two gels together 25 times to get a proper uniform mix, that you hold the plungers both with your thumb and mix together in a consistent manner. So I know that has been a problem for people who just screw the two syringes together, push one plunger through, and then out pops the other. Some people...
Well, good thing, good. Oh, go ahead. I'm sorry, Dr. Doe.
Oh, it's okay. The only other thing I can think of is sometimes the liquid dam has been too runny, and what I noticed is because it's not the material itself, it's the room temperature of the operatory.
Oh, got it. So it actually kind of almost melted.
Exactly. And so, yeah, so either turn the air conditioning on or just do one liquid dam gel application, one tooth at a time.
So once you actually wrap up the gel, sometimes we've noticed that there's almost a settling effect. When do you feel like you get the maximum whiteness when you do it using the BioLase Epic laser? When, is it right afterwards you see the brightest you're going to be? Is it a day later, or can you comment on that?
Usually it's about 24 hours later. So what you see initially is a brighter effect, almost like you've had your teeth, in a sense, pumice, or you've cleaned your counters. You see it brighter, but you'll notice the whiter portion 24 hours later.
Got it. And then usually, is this about the same in terms of all whitening systems will result in teeth fading after a certain amount of time? Is this about on the same level as any other whitening system or in-office whitening system that we're aware of?
Mm-hmm. It's exactly the same. What I can tell you is the laser whitening system will, if you want to compare it with the other systems, the end result is usually brighter and whiter teeth than the other systems, but then the rebound effect is the same as the other systems. And if you want less rebound, where your teeth don't get darker sooner, you just don't have as much darker fluids. So, that answer pretty much is the lifestyle of the patient. So it doesn't matter which system you use, it's the lifestyle of the patient.
Right. Just a couple more questions here for you. One is just, there's been a couple questions on which percentage of peroxide is actually being used with this particular system?
I think it was about 38%.
38%. And then is there any reason you wouldn't recommend this for a patient? I know you mentioned some certain things about picking the right patient, like A2 and above, you're not going to get that wow factor. Is there anything else that you would sort of avoid in terms of if someone came in and asked you about this?
For example, you mean like maybe a pregnant patient?
Yeah, is pregnancy an issue, or a certain age? You wouldn't do it on anybody too young, or?
Yeah, so I definitely would not do it on a patient who's pregnant. I usually would not do it on a patient who's probably less than 21 years of age, because a lot of times patients who are less than 21 years of age, their teeth color is usually an A2. So When I get a patient who I can't get that wow factor for, I usually just resort back to custom trays. Because I notice usually if you go from an A2, if you have an A2 patient, usually you just go from A1 to B1. It's not a huge difference.
Right, right. Well, Dr. Doe, thank you so much. This has been absolutely an awesome lecture. I appreciate all your time and explaining all this. Just so everybody knows, there's a couple questions on some of the brochure and information. There is a document section on the bottom of your browser there, a little tab, and there's a couple of PDFs that you can download that have some more information. And also, just as a reminder, there will be an archived version of this available on Dental Compare. So if you want to take Dr. Doe's lecture and show it to a colleague or to your staff, we will have that ready for you. And you'll actually get an email about that on the one you signed up for when that's available. So again, everyone, thanks for listening. I'm Dr. Jeff Rohde. Dr. Doe, thanks so much for a great day.